Hello guys, welcome to MedCheats. Today we are going to study the anatomy of the heart. First we need to go through the location of the beautiful organ called as heart. So where is the heart located? So basically heart is located in the mediastinum cavity. Mediastinum cavity. So now you will ask, where is the mediastinum cavity? It is the present in the thoracic cavity. So heart is present anywhere in the mediastinum cavity? No. So first of all, there is a line we call as a mid-sternal line, which will separate the mediastinum into left and right. So heart is present on the left two-third of the mediastinal line. So that is the location of the heart. Now if we talk about the weight of the heart, so how much is the weight? Approx 200 to 300 grams of weight heart is having. And if we talk about the size, so size is of a fist, human fist. If you roll on all your fingers and make a closed fist, so heart will look like the same. Okay, so now there are three layers of the heart. Okay, three layers of the heart. Okay, layers of the heart. Okay, which layers we have? First is the innermost layer is endocardium. Okay, second we have is myocardium, which is entirely present with cardiac tissue or cardiac muscle. And the third, the outermost, it's we call as a epicardium. Now epicardium is also having different layers. So the first innermost layer of the epicardium is visceral layer of serous pericardium. So we'll discuss the function and the works of the different layers. So second we have pericardial cavity. So the term cavity means it's filled with something, what we called as serous fluid. Okay, so what is the function of this fluid? To prevent the friction between the visceral layer and the third layer is parietal layer of serous pericardium. So basically we have the fourth layer also, which we called as a fibrous pericardium, which is made up of dense, irregular connective tissue. Okay, so this is the innermost layer, endocardium, then the middle layer, myocardium, which is made up of cardiac muscle or tissue. Then the third outermost layer is epicardium, which is having numerous layers. The first one is the visceral layer of serous pericardium, and the second one is the pericardial cavity, which is present between visceral layer and the parietal layer of serous pericardium. And the last one is the fibrous pericardium, which is made of dense irregular connective tissue. Okay, so if there is any inflammation or any disease related serous pericardium, what we called as in pathology, we called as pericarditis. Okay, so it's the inflammation of the pericardial cavity. So what does serous fluid do? It will reduce the friction between visceral layer and the parietal layer of serous pericardium. Now, why the fibrous pericardium is made up of dense irregular connective tissue? you make a triangle and we'll write fibrous pericardium. So the reason is very simple. It will anchor the heart so that the heart will remain at the position on the 2/3 of the left of the mid-sternal line. Okay, then it will protect the heart. Okay, it will give the protection. How? So if any injury penetrates or anything, so the first layer will give the protection to the heart. And the third reason is which will prevents the overfilling of heart. Now what does it means? So basically if more blood flow is coming to the heart is having a some XYZ amount of capacity which will be limited. So if the blood is overfilling, then the fibrous this dense irregular connective tissue will pushes the heart so that the blood will be removed from the heart. So basically why it's important, it will anchor the heart, it will protect the heart, and it will prevent the heart from the overfilling. Okay, so now we are going to discuss the flow of the blood from various organs to heart to again to various organs. So from the inferior vena cava and from the superior vena cava, the blood will come inside the right atrium. Okay, so first of all, right atrium and right ventricle will carry deoxygenated blood, and the left atrium and left ventricle will carry the oxygenated blood. So from SVC, superior vena cava, and IVC, inferior vena cava, blood will come to right atrium, and from right atrium it will move to right ventricle via tricuspid valve, and from right ventricle the blood will move to pulmonary trunk via pulmonary semilunar valve, and from pulmonary trunk it will move to pulmonary trunk will divide into two: right pulmonary artery and same left pulmonary artery. Okay, so from right pulmonary artery the deoxygenated blood will go to right lung, and from left pulmonary artery the deoxygenated blood will go to left lung. Now the lung will remove out the carbon dioxide from the blood and pour oxygen into the blood, and from there the oxygenated blood will come out to left pulmonary vein and left pulmonary and right pulmonary vein. So here is the right pulmonary vein from the right lung. Now the blood is oxygenated, and there is also a left pulmonary vein. So from there, from the left side of the blood will come. So from these two veins, pulmonary veins, the blood will come into left atrium. Okay, now the left atrium will pushes the blood into left ventricle via bicuspid valve, also called as mitral valve. So from left ventricle the blood will go to aorta via aortic semilunar valve. So here it's not shown, this one is aorta. Aortic semilunar valve is present here. So from left ventricle it will go to aorta. Now aorta is having, if we go further to the aorta, there is a arch of aorta. It means the turning point of the aorta. See, this is called the arch of the aorta. And if you go further ahead, there is a 3 division. Which division? So basically one is brachiocephalic artery, or we called as a trunk. Why we called as a trunk is because again this brachiocephalic trunk will divide into two: right common carotid artery and right subclavian artery. Okay, and this another two, this is one division. The another two division is clearly mentioned: left common carotid artery and left subclavian artery. Now this will divide into further small artery to the various organ. And the remaining, if you go further ahead, there is a descending aorta which will provide the blood flow to the thoracic cavity and to the lower part of the body, which it's shown here, descending aorta to the bottom of the heart. So these are the divisions of the aorta. Okay, brachiocephalic artery or trunk, which will divide into right common carotid and right subclavian, and for left we already having two clearly division of the artery. Now if you seeing the heart, this one we called as a interventricular septum, because it is separating the right ventricle and the left ventricle. Okay, so if any pathology occurs here, what we called as a, in child it's usually present is TOF, teratology of Fallot, which means now the deoxygenated blood can move to oxygenated blood, and oxygenated blood will merge with the deoxygenated blood. So basically the breakage of the interventricular septum. Now we will discuss the layer of the valves. We already discussed the layer of the heart, but now we will discuss the layer of valve. Which valve? Mitral valve or bicuspid or tricuspid valve. So basically it's made up of three layers. The first one, outermost, is zona fibrosa. The second one is made up of zona spongiosa. And the third one is made up of zona ventricularis. So there is a three layers of the valve: zona fibrosa, zona spongiosa, and zona ventricularis. Now the bicuspid or tricuspid valve is attached to papillary muscle in the ventricle, present in the ventricle. Papillary muscle is via the cords, and what we call as the cords, it's called as chordae tendineae. It's chordae tendineae. So this is a thread-like structure which will attach the bicuspid or tricuspid valve to papillary muscle, so that we can stop the blood flow into the atrium, whether it is a left or whether it is the right. So that's it for the anatomy of the heart. We already discussed the blood flow of the entire CVS system. Then we discussed the location, the size and the shape of the heart. Then we discussed the layer of the heart. Then we discussed the layer of the valve, and we also discussed the various function of the valves. Thank you for watching.